Good afternoon again. In this second presentation for today from me, I would like to introduce you our protein biomarkers that are involved in cardiovascular diseases. First, let me summarize what I will talk about. At the beginning, I will mention a little bit clinical background of cardiovascular diseases, that I will show you our feature products. In more details, I will speak about GDF15 and about human heart fatty acid binding protein. Then I will return to portfolio overview and to proteins related to cardiovascular disease and to mentioned products. Cardiovascular diseases globally. This disease is becoming a crisis and a major cause of mortality and morbidity through not only here in Czech Republic, but through all in every region of the world. And it is a cardiovascular disease is a general term for any condition affecting heart and blood vessels. Cardiovascular diseases result in a combined influence of physiological risk factors such as, let's say, bad lipid profile, diabetes, high blood pressure, and behavioral risk factors such as bad eating and no exercising, fat and smoking. Those risk factors lead to endothelial dysfunction, and atherosclerosis refers to cardiovascular disease conditions, and if not treated, can progress to more advanced cardiovascular disease condition and may culminate to clinical events such as heart attack or stroke. This is a selection of our portfolio of cardio biomarker human. In this first three is a group of kind of new ones. Another group, NT-proANP and BNP, are well known now and established. And here is a group of protein that are involved in hypertension, in regulation of blood pressure. I will talk about the GDF15 and after that about FABP3, about PCSK9 you've already heard in a previous presentation, as it is a regulator of low density cholesterol from the circulation. What is the major risk of cardiovascular disease? So let's start with growth differentiation factor 15 or GDF15. This molecule is also well known as under its synonym macrophage inhibitory cytokine 1. And it's a kind of multifunctional molecule. It plays an important role to modulate various disease from metabolic through cancer, chronic kidney disease up to cardiovascular disease. And looking closer to its a role in cardiovascular disease, GDF15 has a kind of cardioprotective function because through activation of receptor it can stimulate and activate pathways which leads to cardioprotection in human heart. And GDF15 is not expressed under normal pathophysiological condition. Its expression is highly induced under some stress conditions such as some injury, heart injury, or pressure overload, or some other stress. And so in short, we can mark this protein as a stress-responsive cardioprotective cytokine. GDF15 as a cardiomarker, it has both diagnostic potential and also prognostic potential. About the prognostic utility, I will tell you later. Now you can see it's a diagnostic potential that this protein is, its levels are high and elevated in patients with various cardiovascular disease condition, from acute to chronic condition, coronary artery disease, heart failure, up to stroke. And what is more interesting, this marker or this protein is independent of clinical risk factors and established biomarkers such as NT-proBNP and cardiac troponin. So even more its diagnostic potential, it has also a prognostic potential. GDF15 can predict higher risk of mortality in cardiovascular patients. As you can see here in this graph, the patients with the highest levels of GDF have worst mortality on a cardiovascular disease than the others with the lower levels of GDF15. The other study brings evidence about its strong prediction in bleeding risk in patients undergoing anticoagulant treatment. Aristotle was a randomized huge study, involved more than 14,000 patients, and in this study 2 drugs, apixaban and warfarin, were compared as an anticoagulant treatment to reducing stroke and systemic embolism in patients with atrial fibrillation. Remind you, anticoagulant therapies, the role of anticoagulant therapy is to block the activity of coagulation factor, and it usually comes with a high risk of bleeding. One of the biomarker investigated in this study was our GDF15, and it shows so strong prediction of bleeding risk that it was involved into so-called bleeding score. A bleeding score is a kind of screening tool to determination of bleeding risk during anticoagulant therapy, and it must be performed by cardiologists for each patient before prescribing anticoagulant therapy, some anticoagulants. And ABC bleeding score now include age, biomarkers, and clinical history. And nowadays, among biomarkers, except hemoglobin and troponin, is our GDF15 as a strong predictor of bleeding. ELISA for GDF15 is typical sandwich ELISA. It is CE-IVD, and in this field we have got a strong competitor, Roche. They have got their GDF15 ELISA automated, and also they published a few clinical studies, and that's why we decided to carry it on a comparison study, and the results are quite satisfied. So we can say that we want to compare with Roche, and we do. We measure as good as Roche on their automate. Another protein, FABP3, hard fatty acid binding protein. It's a valuable diagnostic marker of acute coronary syndrome and heart failure in pathophysiology of myocardial infarction. Its clinical relevance can be described together with kinetics of cardiac troponins. I already said that troponins are kind of golden standard for acute myocardial infarction. And as you can see, troponins, this purple line and a blue one, are released into circulation from the heart from 2 up to 6 hours after onset the chest pain, and heart fatty acid binding protein is released earlier, within 1 hour after episode. So FABP3 is earlier marker than troponins. But to increase sensitivity of test, nowadays it's recommended to measure both FABP and troponin together to identify myocardial infarction in patient with presenting with chest pain with a higher accuracy. And now looking at this ideal combination, I want you to think about the protein I was talking about within my first presentation, and it was a cardiac myosin binding protein C. And we already know that this protein is released within 3 hours after chest pain onset, so its kinetic curve would be somewhere here between HFABP and troponins. So it is also considered to be a very early marker. This biomarker is quite new and not established yet, but having very great potential in diagnosis of heart failure, and maybe one day also myosin binding protein will be here together with FABP and troponin as an ideal combination to detect acute myocardial infarction. Our ELISA for heart FABP or fatty acid binding protein 3 is also sandwich one with huge applications in lots of matrices. It's also CE-IVD, the only ELISA CE-IVD mark now on the market, but there are lots of competitors in field of point of care tests. I chose those two ones as I found them the most relevant, as they were also CE-IVD for EU market. So just to summarize what was already said. Here are the proteins divided into some groups, or let's say kind of cells packages. The first group, protein biomarkers for diagnosis of cardiovascular disease. Another group, mostly for prognosis of cardiovascular disease. And a special group for hypertension. Those proteins are involved in renin, angiotensin, aldosterone system. It's a very complicated system in a body that regulates human blood pressure in human body, and I wish I will tell you about that system next year, maybe some other occasion, because I have no time to tell you more. But anyway, those proteins are also very useful markers in cardiovascular disease. However, we have to keep in mind that our ELISAs are too long method for detection of cardiovascular disease in clinical laboratories, especially acute phases of cardiovascular diseases. But there are lots of options where ELISA still can be used, from research up to preventive diagnosis, monitoring of the disease, or monitoring of the therapy, and clinical studies. And spectrum of potential customers is also huge, from research centers through clinical laboratories up to CRO running clinical trials. This was only a little bit of what the BioVendors offers in a field of cardiovascular diseases, and together with more than 50 ELISA for molecules somehow connected with cardiovascular disease. There are even more proteins and antibodies, and last but not least, microRNA immunoassays. This is a BioVendor's website search for cardiovascular disease, and from those more than 400 proteins, I would like to point those which are related to mentioned products and related to cardiovascular disease. And I would like to point that in our assays, we have got our very own immunogens, and also calibrators are, or standards in assays are our own recombinant proteins that can be cell separately too. And that was a brief intro into our cardiovascular biomarker. And thank you very much for attention. In case of question, you can ask me now, or don't hesitate to email me in the future. And thank you again for attention, and I wish you a pleasant stay here in Brno.
Any questions?
Thank you for presentation.
Thank you.
Do you know about marker ST2 from critical diagnosis company? Because some countries have guideline special for NT-proBNP and ST2 markers. Are you planning to issue these markers in the company?
I think we do have
ELISA
for ST2.
For heart failure. Both.
For heart failure, yeah.
Failure.
I think we do have ELISA for ST2. No, we don't.
Another
Or
name, receptor interleukin-1 antagonist. Because I know some country like China already have guidelines for this, because it's more important than GDF. Maybe you have some information compare with together with some markers, GDF and ST2. Because for our company it's so interesting.
We notice this parameter soluble ST2, and we consider to give it in our pipeline. As I mentioned, we are now working on the transfer of some manual ELISAs to the automated platform, and all these biomarkers mentioned by Viera and by Eva, of course, are candidates for the automated platform for the clinical diagnostics. And then, of course, we are looking for some additional parameters which are, as a ST2, promising for the IVD market, and so therefore we are thinking about this, and yeah, so we have it in our mind.
Our Russian cardiologist already checked these markers. Yeah, it's very potential.
Yeah, so this is very good. This is a very good feedback. Thank you very much.
Do you also have the ELISA kit for troponin? Because you mentioned troponin and FABP3 is recommended to measure
Both together, yeah. But yeah, unfortunately, we do not have.
There were some, because troponin is really a typical IVD marker, which is used in a
rapid test, medicine, I think,
so
yes.
Very often it is used on automated platform, on some POCT devices to have it. Clinicians, they really need to have the result in 20-30 minutes. So ELISA is not a very proper method for this parameter. So therefore, we don't develop ELISA, of course. But as I said 2 minutes ago, so for the automated platform, of course, we will consider such parameters, and we will probably add.